Hello everyone, my name is Dr. Vijaya Kumar and I belong to Department of Periodontics, Yenepoya Dental College, Mangalore. And today I'm here with a small subject to discuss called gingival enlargement. Now what is this gingival enlargement? It is basically overgrowth of the gingival tissues, which is normally you see in the first picture, which is in a healthy gingival tissues. When any part of this gingival tissue, when it overgrows, that condition is called as a gingival enlargement. Now, what exactly by definition gingival enlargement? Now, gingival enlargement defined as a gingival hyperplasia, which refer to as an enlargement of the gums which is exceeding the normal limits of the gingival tissues. An enlargement can be both a marginal gingiva, that is that portion of the gingiva which is near to the gum line, what we call as when the tooth and the gingiva, that is a pink part of the tissues, the gum line, or it can be in between the tooth, that is called as an interdental papilla. And also it can be from any other part of the gingival tissues also. Now, how do we classify this gingival overgrowth? Now, gingival overgrowth has been classified as inflammatory enlargements, drug-induced enlargements, enlargement associated with the systemic conditions and the diseases, neoplastic enlargements, and false enlargement. What is an inflammatory enlargement? Basically, it is nothing but inflammation or infectious agents which is causing an enlargement of the gingival tissues, which appears reddish in color, which can appear in any part of the gingival tissues, is called as an inflammatory enlargement. A drug-induced enlargement is nothing but a group of drugs which can bring about as a side effect of that enlargement of the tissues, which is usually pink in color. That is called as a drug-induced enlargement. Some of the systemic conditions as well as some of the systemic diseases also can give rise to enlargement. They are called as enlargement associated with that of the systemic conditions and enlargement diseases. And a neoplastic, that is basically, as the name suggests, it is related to that as a cancerous growth, and a false enlargement, that is a fake enlargement which happens, which gives you an illusion that a gingival tissue is enlarged. How do we classify based upon the location and distribution of these enlargement? Localized, that is when these gingival tissues are enlarged only pertaining to few or a single tooth or a group of teeth, then it is called as a localized enlargement. Generalized, that means all the teeth are involved or the tissues of almost all the full of the mouth is involved, then it is called generalized enlargement. A marginal enlargement, when enlargement is confined only to that of the marginal tissues, as I said earlier, that is the junction between the tooth and the gingival tissues where it begins, that is called marginal gingiva. If the enlargement is pertaining to that area, then it is called as a marginal enlargement. A papillary enlargement, it is basically an enlargement which is starting in between the tooth, that called interdental papilla. And a diffused, that is when the enlargement involves all the three components of the gingival tissues, that is marginal, interdental papilla, as well as the attached gingival tissues. Let's go into the one by one enlargement. There's a group of enlargement called as an acute gingival overgrowth, or enlargement what we call. Acute means it's in a sudden onset, suddenly it appears. So there are basically two types of it. One is called as a gingival abscess and a periodontal abscess. Usually it comes with the pain. The patient experiences a pain in this scenarios. A gingival enlargement or an abscess which is confined only to the gingival tissues, then it is called as a gingival enlargement, or the gingival abscess, which is mainly due to some of the foreign particle gets impregnated within the gingival tissues, leading to an abscess formation. Second is called as a periodontal abscess. Periodontal abscess is nothing but when infection spreads into the supporting structures of the tooth, that can lead into a localized accumulation of the pus and leading to enlargement of the gum tissues, that is called as a periodontal abscess. These are the two acute conditions, and usually it is painful situations, and patient comes to your clinic with the painful abscesses in the mouth. It could be, most of the time, these are the two things which will be localized to one particular areas. As I said earlier, inflammatory gingival enlargement. Now, inflammatory gingival enlargement is nothing but this is an enlargement which can happen in the gingival tissues due to the infection which is caused due to the microbial plaque. The plaque which accumulates over the calculus, and that leads into a localized inflammation of that area, and that inflammation leads to initial enlargement of the marginal and the interdental papilla, and subsequently, if it is untreated and if the patient is not maintaining the oral hygiene properly, then these inflammation and infections can spread into the supporting structures further and leading into an enlargement of the entire mouth. This is called as an inflammatory enlargement. Typically, this subside within a subsequent removal of the local factors which are causing this enlargement. If you remove the local factors, automatically the inflammation subsides and the inflammatory enlargement comes down. How it looks like? Typically it looks reddish in color as it looks in the picture. Starts with the marginal lesions, it can spread into interdental areas, and if you see the one of the picture which is showing that the large enlargement, that is a combination of both inflammatory as well as the fibrous. Eventually this inflammatory enlargement, if it is an untreated and if it is left without any kind of an intervention, subsequently they can overgrowth and get converted into a small fibrous enlargement, and this is the time when patient obviously notices it and it becomes an aesthetic concern, and patient usually reports to the nearest dental offices. Next is a drug induced, which is the most common, around 4 to 7% of enlargement, which usually affects the population. In that, one of the common one is called as a drug induced gingival enlargement. This is one of the side effect of certain drugs which are used in treatment of certain systemic conditions, like especially epilepsy or hypertension or any kind of immunosuppressive drugs. These are classified as an antihypertensive drugs, anti-epileptic drugs, immunosuppressive drugs. These are the group of drugs or the class of drugs as one of the side effects of them as a gingival overgrowth. Typically, this enlargement usually starts in the interdental areas, that is in between the teeth, and eventually they spread into the other areas also, and finally small like a blob like tissue overgrowth will be there, which will be usually pink in color, and more fibrous tissues will be there, and they coalesce together and they can form an enlargement to a larger extent, and it causes an aesthetic concern and a difficulty for a patient to maintain those areas. As a result of that, accumulation of the plaque and oral hygiene maintenance difficulty, the accumulation of the plaque continues, leading into an inflammatory enlargement. So usually this drug induced enlargement will be associated along with that of the inflammatory enlargement as a secondary cause for the disease. The third one, common drug, which is the immunosuppressive. If you see the one of the picture there, which is very reddish in color, which is very friable, when you touch these areas, this typically bleeds. These are the enlargement usually seen in case of a drugs which is used as an immunosuppressive agents. Next is the commonest one is called as one of the rare enlargements are called as a idiopathic gingival enlargement. Now what exactly is idiopathic means? It's related to a genetic condition or a very genetic condition where you get a typical growth of gingival tissues to a larger extent, and it becomes an obviously visible to others. So most of the time when idiopathic gingival fibromatosis happens, it is usually of aesthetic concern for an individual. In some of the rare cases, it grows to such an extent that it almost covers the entire tooth, and the teeth will not be visible in the oral cavity. And in severe cases, it might require surgical interventions to treat these conditions. So it's a rare genetic inherited kind of a diseases condition which happens usually in some of the younger individuals. Next is certain gingival enlargement which are associated with the systemic conditions and the diseases. And the systemic conditions in the sense the whole of the condition of the body which can bring about some kind of a changes in the gingival tissues. One of the commonest one is a pregnancy enlargement. This is usually we see when there is a typical rise of the hormonal changes which takes place in a pregnant woman, can have a small enlargement in the gingival tissues, and these are called as a pregnancy epules. And usually these enlargements subsides or disappears once the pregnancy is over. But during the pregnancy conditions, and whenever there is a oral hygiene status is not maintained very well, and if there is an underlying existing periodontal diseases are present, then the situation can become worse, and those epules grows larger in size, leading into functional problems as well as an aesthetic problem for the young ladies, and it might require maintaining the oral hygiene or intervention by the dentist to reduce the infection which happens, but overall does not require any kind of a surgical interventions for pregnancy associated gingival enlargements. Another condition is called as a prepubertal gingival enlargement. Now, this is a situation usually happens in a young adolescent individuals when there is an hormonal changes during the growth phase when it takes place. Typically, some part of the gingival tissues, especially the marginal gingiva or the interdental papilla, can bring about an enlargement, and usually these enlargements will be in a bright red in color, and when it touches it bleeds. But if the oral hygiene maintenance is very good, and interventions by the dentist to doing a regular scaling procedures and remove the local factors which increases the inflammation, can reduce the frequency of this pubertal gingival enlargement. Vitamin C deficiency induced enlargement, which usually very rare cases in the present world, but in earlier days it was in a typical vitamin C deficiency enlargement which you will see in the gingival tissues, and generally included a classical description which is called as a scurvy, is one of the clinical signs of scurvy. The gingiva becomes bluish red in color, it is soft, friable and has a smooth, shiny surface, and typically this requires, again it will be secondary infected with the poor oral hygiene because of the overgrowth of the gingival enlargement. Usually all these generalized conditions will be associated along with that of the poor oral hygiene. As a result of that, an inflammatory component also will be added to that of the enlargement, and treatment of this involves one, definitely correcting the vitamin C deficiency, plus maintaining the oral hygiene. Automatically this condition can be reversed. Some of the non-conditioned gingival enlargement, which is earlier called as a pyogenic granuloma, this is nothing but a small tumor-like enlargement which is seen both in males and females, but in the female predilections are found to be little higher. This is an exaggerated condition to response to a minor trauma, but typically exact reason is not to be found. It is a discrete spherical tumor-like mass with the pedunculated attachment or a flattened. Pedunculated means a lesion will have a larger bulk of the tissues, but it will be attached to the underlying tissues with a small stalk. That's why it's called as a pedunculated. And when this entire lesion is completely flattened over the surface of the gingival tissues, then it is called as a diffuse lesion. Usually it is bright red in color and purple, or either friable to pressure, or when you brush it bleeds. And pyogenic granuloma, sometime when you maintain the oral hygiene, usually it disappears, and sometime it might require surgical interventions. Some of the systemic diseases which can cause a gingival enlargement. Leukemia is one of the common conditions, usually will be manifested as a severe gingival enlargement in the oral cavity. It appears as a diffused enlargement involving almost all the gingival tissues and oversized extension of the marginal gingiva. Sometimes it may appear like a discrete small tumor-like lesions in the initial stages, and the later stages it involves the entire oral cavity or the entire dentition. Consistency is moderately to firm or a soft in consistency, but one of the typical features of this leukemic infiltrated gingival tissue is tendency to bleed. Even with the slightest provocation also you will see a bleeding. That is where the patient referred or patient reports to the dentist with the complaints of bleeding gums, and this is the typical of, if you see the first and the second picture, is a classical of leukemic infiltrated gingival enlargements. Next is called as a neoplastic enlargement. As the name suggests, yes, neoplastic is nothing but a malignant. Two types of a malignant neoplastic enlargement are seen. One is called as a benign lesions, one is called as a malignant lesions. A benign lesions are the one which is non-dangerous one, which just grows in a size, but they do not metastasize or they do not infiltrate in the surrounding tissues. Example like a fibroma or papilloma, these are the lesions which are usually a benign kind of a lesions. Typically they just requires an excision, and they do not recur. Whereas a malignant lesions are the one typically with a tendency to infiltrate into the surrounding tissues, which could be the bone, or on a distant metastasis also into the lymph node can take place. Commonly in the gingival tissues, what we see in a neoplastic enlargement malignant variety is called as a squamous cell carcinoma. So it is an intraoral swelling which can appear in any part of the gingival tissues, and usually there won't be any kind of a pain in the initial days, but as the ulceration of this enlargement takes place, typically the pain arises, and difficulty in wearing a denture or difficulty in maintaining the day-to-day routine oral hygiene practices becomes difficult. That is where usually the patients come to the dentist. One more category is called as a false gingival enlargement. Now, false gingival enlargement is nothing but typically it gives an illusion that it is an enlargement, but there won't be any kind of a pathological changes which is happening in the gingival tissues. It is not because of the pure enlargement of the gingival tissues, but there will be an underlying changes which is happening in the bone, which could be a developmental or it could be a pathological also sometime. This enlargement gives you a false illusion that even the gingival tissues also enlarged. But if you look at the texture of these gingival tissues, appearance of these gingival tissues, they appear normal in the consistency and normal in the texture also. This is called as a false enlargement, and if it is related to the development enlargement, usually does not require any kind of a treatment unless it interferes with the normal aesthetics and functioning or in denture related treatment aspect, and that is the time when you require a surgical interventions of this kind of enlargement. That is called as a false gingival enlargement. What are the typical clinical features usually when patients come to you with the gingival enlargement? Almost all the gingival enlargement which belongs to different various categories will have a typical clinical features which is common for almost all the enlargement, but some of the enlargement will have classical features for the enlargement. But what are the typical regular features which usually a dentist should look for when an enlargement is there? One is redness and inflammation of the gums. This is a common thing which you see in an inflammatory component. Whenever there is an inflammatory component is associated with any enlargement, you will notice there is a redness and inflammation in the gums. Second is bleeding upon brushing or a flossing. So whenever a patient brushes his teeth, you will see a bleeding gums. That is the second commonest problem where the patient come to the dentist. Difficulty in maintaining a proper oral hygiene. When some of the drug-induced enlargement which typically grows to a larger extent, maintaining a regular oral hygiene becomes very difficult, and when you have this enlargement and they will form a multiple folds of tissues, and these food particle gets entrapped within these fold of tissues, what we refer to as a false gingival pockets, and that leads into a next condition called as a halitosis because of the accumulation of the food particle which decomposes in the oral cavity and gives a foul smell in the mouth. That is called as a halitosis, and in severe cases sometimes the amount of the pressure which is put forward, especially a fibrous kind of enlargement, can bring about or put forward or put an amount of a pressure onto the tooth which can bring about the movement of the tooth into any direction, either the forward or in the lateral directions. That is called as a displacement of the tooth, which is leading in turn into a condition called as an occlusal disturbances, which leads into further problematic situations in future. So these are some of the common signs and symptoms which is associated with most of the gingival enlargements. How do we diagnose this gingival enlargement? So whenever a patient comes to you with the typical signs and symptoms of enlargement, more or less when the patient comes to you, when he notices it, when clinical examination, when he looks for it, when he notices a frank enlargement, that is where they come to you. So what do you need? You need to take on a comprehensive, complete clinical examination. You have to do it. How does a gingival enlargement look like? Where does the gingival enlargement is originated? Whether it is in a localized or whether it is in a generalized enlargements. All these complete detailed clinical examination has to be done. A medical history review as well as a complete case history has to be recorded. A medical review should involve all the medical conditions what patient is having or had or having, or any kind of a medications he is been taking, or right now he is on a medication. A complete detailed history of his medical history has to be recorded and try to rule out the potential causes for the enlargement. Third one, after the complete clinical examination, a radiographic examination also required to rule out any kind of involvement of the tooth related problems as well as the bone related issues. You want to see changes in the bone as well as the tooth, you need to take a complete radiograph, either it is in the form of an IOPA or an OPG called orthopentomograph. A complete periodontal examination, clinical examination, which involves a complete detailed gingival examination as well as the periodontal examination, that includes the charting as well as the recording of the pocket depth as well as attachment loss, has to be done. A detailed clinical charting has to be done. And in some of the cases, when the enlargement of severe and you have a doubtful situation, in further investigation called as a biopsy has to be performed to rule out any kind of involvement of malignancy or a benign kind of lesions. What are the different treatment options? Depending upon the type of the enlargement, and once you have diagnosed what is the cause for the enlargement, usually the treatment will depend or depend upon the type of the diagnosis what you have achieved. If it is an inflammatory enlargement, typically the cause for the inflammation or what is the root cause for the inflammation or infection which has happened, most of the scenario it will be plaque associated or the retentive factors. If you remove the plaque and plaque retentive areas, then automatically the inflammation and infection will subside and inflammatory enlargement will typically resolve following the periodontal treatment. Okay. And a drug-induced enlargement usually requires, again, if it's an inflammatory component is associated along with the drug-induced enlargement, then you need to treat the inflammatory component first. That will reduce to a larger extent, amount of inflammatory enlargement will be reduced, and whatever remaining a fibrous enlargement which is caused due to the drug effects can be surgically managed with the surgical interventions, or in a severe scenarios you need to alternate the drug. With the consent of the medical practitioners, whoever he has been going into, you refer the patient for an alternative medicine for the particular condition can be done. A hormonal gingival hyperplasia typically usually resolves when the hormonal fluctuations have subsided or comes down, it will be subsided. Sometime hormonal therapy also may be considered in some of the situations. Fibromatosis gingival enlargement, in a severe cases definitely it requires a surgical interventions, and various surgical modalities are there for an excision of these gingival tissues, starting from that of the conventional scalpel method to that of the advanced laser therapies or any other electrocortic therapy can be used, or the surgical techniques can be used to excise the gingival tissues, and those are the treatment for the fibrous gingival hyperplasia. Any enlargement which is associated with that of the conditions like pregnancy associated, typically the inflammatory component of or the oral hygiene maintenance has to be improved, and automatically the remaining enlargement whichever is present, once the condition is or the pregnancy is over, automatically the enlargement will be subsiding by itself. What about the prognosis of these enlargements once the treatment is been done? Yes, the maintenance of the oral hygiene is very important in these cases. Early diagnosis and treatment is crucial for the optimal outcome of gingival enlargements. Once the enlargement is done, a proper oral hygiene maintenance has to be done in order to prevent the further recurrence of this enlargement, and a recall and review of these patients are definitely required in order to keep an track of the enlargement recurrence which is happening, especially in the case of a drug-induced enlargement. It is not that once the treatment is done, the drug-induced enlargement will not recur. As long as the systemic drug administration will be continuing, even the enlargement possibility of recurrence is there. So in such situations, you have to recall the patient, or a periodic recall and maintenance care has to be given for the patients. So this is about generally a brief introduction about the gingival enlargement. So gingival enlargement have a varied etiology and different clinical and histopathological features. Correct diagnosis of the condition and a prompt treatment for the condition is definitely required, and further maintenance of the oral hygiene is a very important factor in preventing the recurrence of these gingival enlargements.